Hello everyone, welcome back to this channel. Today, we're going to myths and facts about breast cancer part 2. Let's go. Anytime your mammography results are negative, it's acceptable to exhale with relief. Most women dismiss their risk of breast cancer by saying, "I'm good for another year." Mammography is a very effective screening method, although it is not infallible. It may give a false negative result, which means that cancer may be present but the scans appear normal. Mammograms are thought to miss roughly 20% of breast cancers while they are being screened. Women who have dense breast tissue, which is composed mainly of glandular and connective tissue than fatty tissue, are more likely to experience false negative results. Dense breasts are more common in younger women. It is possible for a woman to have a normal mammography test and then receive a breast cancer diagnosis a few months later, which is made possible by the reality of false negatives. Even after receiving a series of normal mammograms, some women may still receive an advanced breast cancer diagnosis. Additionally, breast cancer can grow and develop rapidly a year or so after a true negative mammography. However, mammography does detect the majority of breast cancers, which is why routine exams are crucial. But it's also critical to monitor any changes in your breasts, conduct monthly breast self-exams, and get a yearly physical exam of your breasts by a medical practitioner. Many individuals think there is essentially little possibility of early-stage breast cancer returning, which is defined as breast cancer that has not spread past the breast and underarm lymph nodes. Even while most people with early-stage breast cancer won't, the risk never fully vanishes. Another untruth, breast cancer won't recur if it doesn't return within 5 years. Even though the first 2 to 5 years have the highest recurrence risk, recurrences can still occur afterwards. These misconceptions cause some early-stage breast cancer patients to feel entirely unprepared when they experience a recurrence. People with stage I, low-risk hormone receptor-positive breast cancer nevertheless have a 15–20% chance of recurrence 20 years after diagnosis. Recurrent breast cancer can be local or regional, meaning it comes back in the breast or chest area where the original cancer was found, or distant, meaning it comes back in another part of the body, such as the bone, liver, or lungs. Distant recurrence is also called metastatic or stage IV breast cancer. If you're diagnosed with early-stage breast cancer, your treatment team can help you understand your risk of recurrence. Many different factors can influence risk, such as 1. The initial tumor size. 2. How many lymph nodes are affected. 3. Quality of the cells, like how abnormal they were in appearance. 4. Whether the malignancy had additional copies of the HER2 gene or tested positive for hormone receptors. 5. The particulars of your treatment strategy. This information can also be useful if you underwent a genomic test like Oncotype DX, which examines a set of genes to determine the likelihood of recurrence. It is true that the 2 main risk factors for getting breast cancer are gender and advancing age. Invasive breast cancers affected roughly 4% of women under the age of 40 in 2017, 23% of women in their 52nd, and 27% of women between the ages of 60 and 69. 4% may seem insignificant, yet it is not zero. According to this ratio, invasive breast cancer affected 1 in every 25 women under the age of 40. Women of all ages should pay attention to their breasts, undertake self-exams, and notify their doctors of any unexpected changes. If there is a concern-inducing symptom, women should request that breast cancer be ruled out. Even some doctors subscribe to the false notion that breast cancer doesn't strike women in their 20nd and 30nd. Women who have a significant family history of breast cancer, particularly those who have had the disease in a relative before the age of 40, may want to begin tests earlier. Although it does occur, breast cancer in men is far less common. Males have breast tissue, despite the belief that men cannot get breast cancer because they lack breasts. Less than 1% of breast cancer diagnoses in the United States are in men. A total of 2,670 men are anticipated to receive a diagnosis in 2019. 7 male breast cancer is uncommon, but because men and their doctors rarely associate breast changes and lumps with breast cancer, it sometimes goes undiagnosed until it is more advanced. Male breast changes must also be examined. breast cancer patients frequently say that after undergoing treatments including surgery, radiation therapy, and chemotherapy, their loved ones anticipate that they will be prepared to move on. In fact, doctors may recommend targeted therapy like Herceptin, chemical name trastuzumab, for a year or longer. Tamoxifen and aromatase inhibitors are two examples of hormonal treatments that are frequently administered for up to 10 years. A woman may need to undergo many procedures over the course of several months if she decides to have her breasts restored. Additionally, treatment will continue for the remainder of the patient's lives if they have metastatic or stage IV breast cancer. Long-term negative effects can occur even after primary treatments are finished. Depending on the course of treatment, some of these side effects may be physical, including menopausal symptoms, pain and tightness, exhaustion, skin changes, and neuropathy or tingling and numbness in the hands and feet. In addition, there may be psychological and emotional side effects, including as relationship difficulties, anxiety, and fear of recurrence. The impacts of breast cancer can persist for many people for years or even forever in the event of metastatic breast cancer, yet their loved ones often fail to understand this. Hers is a typical experience. There's really no reason to study the ins and outs of treatment if you haven't had breast cancer or aren't connected to somebody who has. Many people are only vaguely aware that treating breast cancer may involve a mix of surgery, radiation therapy, and possibly chemotherapy. They might not be aware that speaking with 5 different breast cancer patients will reveal that each of them has a unique treatment regimen. This is due to the fact that each patient's treatment plan is specifically created to meet their needs. There are a plethora of variables that can influence the selection of therapy.